Hi, my name is Bitzal Dance, and I'm the Director of Medical Student Education in Psychiatry at Rush. I am charged with the task of teaching you about mental illness throughout your 4 years of medical school, and hopefully I'll be working with each one of you over the next 4 years. Today we're going to be talking about eating disorders. The eating disorders are comprised of 3 major categories: anorexia nervosa, bulimia nervosa, and binge eating disorder. As with all psychiatric illnesses, we have a category for diseases that don't have specific names, and we call them eating disorders not elsewhere specified. I want to start just talking about the cultural phenomenon of slenderness. This is most commonly found in developed countries. Note that the average woman is 5 feet 4 inches and weighs 140 pounds, which gives her a body mass index of 24, whereas the average model is 5 foot 11 inches and weighs 117 pounds, a body mass index of 16, which most might consider reflecting an eating disorder. Most fashion models are thinner than 98% of American women. The incidence of eating disorders began to surge in the 1970s, shortly after the introduction of the birth control pill and women's entry into the workplace. This has led me to wonder whether slenderness is a backlash to women's financial and sexual freedoms. So, a couple of questions here about eating disorders. So, is it a disease of modern times? It was described, anorexia nervosa at least, was described in medieval times. It was a phenomenon that was primarily displayed by extremely religious women who abstained from material pleasures such as food. The first real description in the medical literature occurred in 1689 by a physician named Richard Morton, and he described anorexia nervosa, in his words, as nervous atrophy. In the late 70s, early 80s, this disease of anorexia nervosa became increasingly popularized by the media. Karen Carpenter, who's an American singer, died in 1983 from anorexia nervosa, was primarily inducing heart failure. And this put eating disorders on the map and introduced it to modern lexicon. Here you see the yearly incidence of anorexia nervosa, almost barely existent in the 1930s, and since 1970 you see that rise up to 5 per 100,000 individuals in the US. Another way to look at the tyranny of slenderness is to look at the photograph on the left of Marilyn Monroe versus the cover of Vogue magazine in February of 2017. And you can see how the concept of beauty has shifted with time. It turns out about 1 in 5 women have eating disorder behaviors. And in high school students, that's about 10%. And as many as 10% college women suffer from a clinical or nearly clinical eating disorder. 90% of these cases occur between the ages of 12 and 25. The male to female ratios are arguably 1 to 10, so much fewer men than women, but men constitute 40% of those exhibiting binge eating disorder. Of men, gay males have the highest risk of an eating disorder. So these numbers lead us up to 10 million women with anorexia nervosa or bulimia nervosa, 1 million men with either of these disorders, and many more with binge eating disorder or subclinical eating disorders. Let's define anorexia nervosa. It is restriction of caloric intake leading to a significantly low body weight, defined as 85% of that expected for the height and age. Along with that, there's an intense fear of becoming overweight, and the afflicted individual has a marked disturbance in their self-image. They look in the mirror and they see somebody who's overweight and certainly not thin. There are 2 types of anorexia nervosa, the restricting type and the binge eating or purging type. The restricting type of anorexic does not binge eat or purge. She just restricts her food intake and exercises excessively. The binge eating or purging type, this individual engages in binge eating or purging behaviors such as vomiting, using laxatives, diuretics, or enemas to keep her weight low. The severity of anorexia nervosa can be divided into mild, moderate, severe, and extreme. And here you have the body mass indices that would define severity of anorexia nervosa. In that light blue color, I have shown you how many pounds that would translate for an average woman of 5 feet 4 inches. And you can see these are pretty thin people. And the remarkable thing is they think they're fat. What is the characteristic features, or what are the characteristic features of anorexia nervosa? They feel proud that they can control themselves. They're perfectionistic. They live by this mental math torture. They have to know the caloric value of everything they put in their mouth or everything that they see. And they have to know exactly how much caloric output via exercise. They also have this phenomenon of the new normal, which spirals downward. So let's say a woman says, my ideal weight is 110 pounds. Well, she gets a little scared if that goes up a little about over 110. That means that she's going to get fat. So then she says, well, I feel much better if I'm at 108 because then I have a little leeway before I become any higher than 110. So then the magic number becomes 108, but you can see that then starts becoming 105, 100, etc., as this mental math torture afflicts the victim of anorexia. The anorexic is hungry, and she's obsessed with food. She dreams about food. She loves going to grocery stores and looking at food. She has eating rituals, for example, cutting apples into 10 little pieces and eating them one by one or even saving some for later. Anorexics love to cook, prepare gourmet meals. They love to make brownies and cupcakes, etc. They have very little insight into the fact that they're ill, and they deny that they have an eating disorder. As a result, they may hide, lie, or deceive others to avoid detection by claiming that they've eaten more than they truly have, by wearing baggy clothes so no one can see how thin they are, and lie in terms of denying that they've ever used purging techniques to lose weight. Very hard for a clinician then to trust what the anorexic tells him or her. Now, why does the patient come to clinical attention? Usually it's the family of the adolescent girl that is concerned and brings the patient into the doctor's office. The patient herself may present for medical care due to the consequences of caloric restriction: fainting, fatigue, shortness of breath, constipation, and the psychiatric symptoms of depression, irritability, and anhedonia. Anhedonia refers to a lack of experiencing pleasure. As a person cycles down in the spiral of starvation, it becomes really hard to enjoy anything when the entire focus of the individual is about losing weight. So this is the third most common chronic illness among adolescents. Those of you going into pediatrics will be dealing with this quite a lot. Sources state that the lifetime prevalence is 0.9%. That seems a little low to me, and the reason probably is that I, like many of you, have been surrounded by individuals at higher socioeconomic status, and in that population, lifetime prevalence is much higher. The annual incidence in young women is 0.4%. There's this 10-to-1 female to male ratio. Males are much less likely come to clinical attention or to admit that they have an eating disorder. The peak onset of anorexia nervosa is between 14 and 18, and the mortality rate for anorexia nervosa is about 5% per decade. People die by suicide or medical complications such as cardiac disease. A bunch of occupations to keep in mind that are hazardous for individuals. Dancers, gymnasts, wrestlers, athletes, models, and actresses top the list. And when you see people with these professions, important to screen for an eating disorder. Up here you have a eating disorder survey, which is the most common survey used to detect and address severity of eating disorder. Hopefully on your screen you can magnify this and see the questions. I think they're very helpful in understanding the various ways in which people try to lose weight. The medical complications of anorexia nervosa are listed here. I want to point out several things. So cardiac consequences include cardiomyopathy and fatal arrhythmias. We'll be talking about that shortly. Endocrinologic complications include osteoporosis, and interesting, anorexics are also prone to get hyperlipidemia. Gastrointestinal problems include profound constipation, gastroparesis. Patients can get seizures, primarily from electrolyte abnormalities. They can have iron and vitamin deficiencies. In dermatologic consequences, dry skin, peach fuzz type hair, hair loss, and carotenodermia, which is palms particularly having a carrot-like appearance from excessive ingestion of carrots. They can get anemia and even reduction in white blood cell count and platelets. And consequences of starvation can include major depressive disorder, substance use disorders, as an individual uses substances to help them lose weight. During starvation, there's cognitive impairment, and these conditions, anorexia nervosa, can lead to suicide. So here's an example of a nugo hair on a baby, and hopefully you can appreciate these fine peach fuzz type hair on babies. This also occurs in individuals suffering from anorexia nervosa. This is the dreaded torsades de pointe, which occurs as a result of electrolyte derangements, particularly hypokalemia and hypomagnesemia, found in individuals with anorexia nervosa and bulimia nervosa, and is a prelude to ventricular fibrillation and cardiac arrest. The indications for hospitalization in individuals with anorexia nervosa include a weight with a body mass index of lower than 15, unstable vital signs, and medical complications requiring urgent care. We talked about arrhythmia, heart failure, and all these metabolic disturbances, pancreatitis, marked edema. Probably should include their severe psychiatric illness, including suicidality. Another indication for hospitalization is someone who's failed to respond to outpatient treatment. What are the treatments? Well, it's got to be multidisciplinary. It needs to be dietary counseling by a nutritionist, and this thing called nutritional rehabilitation. Individuals need to have supervised, structured meals where they're being watched carefully for their caloric intake. They can't get to the bathroom afterwards where they might purge. You got to keep them for an hour after they've eaten their meals to make sure these meals are going to go through the GI tract. Anorexics are prohibited from exercise. There can be positive and negative reinforcement. So the parent can say to the child, look, if you eat a reasonable meal, we'll let you go out for a walk. Negative reinforcement would be, if you don't eat, we're not going to let you exercise, we're not going to let you dance, we're not going to trust you outside the home, etc. Another treatment is, actually most women or most girls and most victims of this disorder will need individual psychotherapy. Particularly cognitive behavioral therapy has data for its efficacy. Family-based therapy is absolutely essential. The family needs to be on board and needs to use the supervised meals, positive and negative reinforcement that will compel the patient to eat and prevent her from purging. Now, there are a lot of comorbid psychiatric conditions that may be the result of anorexia or may be concomitant. Those include major depression, all kinds of anxiety disorders, obsessive compulsive disorders, substance use disorders, post-traumatic stress disorder. Many of these girls have experienced physical or sexual trauma, and personality disorders, particularly obsessive compulsive personality disorder, aka perfectionism and the kind of anal personality, is found in these people. The prognosis is listed here, a 5.9% risk of death in the next 10 years, primarily due to cardiac causes and suicide. 50% of patients will remit, 25% will have an intermediate course, and 25% a poor outcome. Recovery can take 5 to 7 years. Best prognosis when the family is involved, and a good prognostic size, young age of onset, good insight, social support, higher initial body weight, and supportive family. The next topic we're going to discuss is refeeding syndrome, and we'll put that in a different video.